Thanks so much for joining me today. I'm Dr. Catherine, a GP, and today is one of my Ask the Expert sessions with consultant gastroenterologist Dr. Gareth Parkes. We'll be talking about your gut and, importantly, how to get to know your bowel symptoms. Don't forget to hit the subscribe button, ring that bell, like and share. Make sure you watch through to the end to hear his top tips. Gareth, tell us a bit more about our gut and what the different parts do for us.
Well, I'm a bit biased as a gastroenterologist, but I think the gut is an amazing organ and part of your body. And obviously, it's one that we can't live without. Its chief function is to take the food we eat and the drink we drink and to turn it into nutrients and energy and store that in our bodies to allow us to do all the things that we enjoy doing. And it's got a bit of a bad reputation because it's icky and because of what comes out the other end. Most people sort of prefer not talking about it. And actually, that can be the detriment to patients' health. So in order to take you through a journey through the gut, I'm going to break it down into six different parts, some of which we all know about and some of which you might not know quite so much about. So starting at the top, as it were, and the gut is 10 meters long in an adult male, all coiled up inside you, or 30 feet in old money. The mouth is a pretty simple and straightforward organ, and most of us know all about that. So its job is to chew up food, obviously, and to drink and swallow things down into the food pipe called the esophagus, and then on into the stomach. Most of the problems that go on in your mouth, you're probably going to go and see a dentist for, rather than coming to see someone like me or your GP. And good dental hygiene is obviously super important. Occasionally, other diseases can manifest in your mouth. If you've had ulcers or a lump that you've noticed that's persisted and hasn't gone away, then that is a sign potentially of something else going on. You can always get things like mouth cancer. Very important not to smoke. It's a big risk factor for that. But yeah, pop and see your GP about that. Then we go through to the esophagus, which is a tube that goes from the back of your throat down into your stomach. That's a really clever tube, actually, and I suppose goes wrong in probably two different ways. The commonest is most of us at some point in our life will have had something called heartburn. That's a kind of burning discomfort just at the bottom of our chest, just above where the rib cage ends. And that's caused by acid, which is naturally occurring in your stomach, coming up into your chest. And when it does that, it irritates the esophagus and causes that burning pain. You might even feel a bit of acid taste in the back of your mouth. It's typically worse if you've eaten very late and then gone straight to bed, because now you're lying down flat and it can all slosh up. It's worse if you've had a very heavy meal, particularly high fat content or high spice content. Both of those can trigger those kind of attacks. And it should settle with antacids, which you can buy over the counter. If it isn't, or if it's persistent, then that's a reason for you to go and see your GP, because it might be that you need stronger medication, or more importantly, to try and change some of those lifestyle factors. The other thing that we always worry about in the esophagus is if you're having problems with swallowing, and that's super concerning. Any problems where you can't swallow down properly, that's something that we would really worry about, and you should absolutely go and see your GP about that. And you do need a camera test to see if there's a blockage in there. We then move into the stomach, which is a clever organ because it allows us to just eat 3 times a day, which most of us will do, rather than having to constantly graze. It doesn't actually do a lot of digestion. Most people think it does, but it doesn't. It's a sort of reservoir that allows food to slowly move down into the small intestine, which is where we do all the clever stuff. The stomach, if it can go wrong, can give us indigestion. All of us at some point in our lives will have had that. Classically, of course, it can cause nausea or vomiting. That's a really common symptom. But if it's persistent, or if in particular you're losing weight, then that is a reason to go and see your GP. And then we come to the really clever stuff, the small intestine, which is hugely long, snaked up inside us. And this is where all the magic happens. And essentially the nutrients that we eat, the food that we eat, is broken down into a liquid slurry, and all these enzymes attack it to turn it into micronutrients, which we can then absorb in through the small bowel and into our bloodstream and store all that energy and build new bones, muscles, protein, all of those kinds of things. So that's super important, and we absolutely cannot live without our small intestine.
What happens if the small bowel goes wrong?
If the small intestine goes wrong, it's quite a narrow organ. So the first thing is you're probably going to lose weight. If it's not working properly and you're persistently losing weight, then that's always a sign that we're a bit nervous about, and come and see us. You might have symptoms in other ways because you've been losing nutrients, so you might find you're anemic or something like that. And finally, it can get blocked. And if that happens, you get intense pain, normally after eating, associated with bloating and vomiting. And then finally, we get down to the lower end, the bits that people feel a bit more squeamish about. So the large intestine, or colon, you can actually live without. The job of the colon is to reabsorb water and electrolytes, things like salt. And it does that by sucking the water up back into our bloodstream. So it's super clever, and turns a liquid slurry into a sort of firm poo that we can do once a day. And that can vary. So anytime between 3 times a day and 3 times a week, we call normal. If there's a problem with the colon, in particular if it becomes inflamed, you'll notice that in the form of diarrhea. So you'll go to the toilet a lot more often, or there'll be a lot more urgency. You'll need to run to the toilet. And then finally, of course, you might notice blood in the stool. If it's mixed in with the poo, so the blood appears to be sort of twisted inside it, that is something we are quite concerned about. And it does suggest that the bleeding is coming from your colon, and you should absolutely go and see your GP about that. It doesn't mean that you've got bowel cancer, but there's always a small risk, and we can have a look up inside with something called a colonoscope. Just below that, though, is the anus. Now, that's the bit that you can wash. So that's the bit that most of us know about, and that's a sort of tight muscle. And a common problem with the anus is that you can get something called hemorrhoids. So by far and away, the commonest cause of blood in the poo are hemorrhoids. And in fact, 1 in 4 of us in our lifetime will have a bit of blood in our stool at some point. Hemorrhoids are caused by delicate blood vessels that sit around the anal canal. And in particular, if you strain or find it difficult to go to the toilet, they become a bit inflamed. And they can pop and bleed, and they can look really catastrophic. Lots and lots of bright red fresh blood in the toilet. You can feel very panicked and worried about that. But again, a quick trip to your GP at that point, and it can normally be easily dealt with. It's often painful when you go to the toilet at that point. There are obviously a myriad of other ways in which the bowel can go wrong, but that's a sort of quick summary.
Thanks, Gareth. That's really helpful to understand what's normal and which gut symptoms to look out for. If you want to find out more, take a look at another session with Gareth and I talking about what you can do to help yourself get more good bacteria or COVID-19 gut symptoms. In the meantime, don't forget to hit the subscribe button, ring the bell, like and share and comment. I'm Dr. Catherine saying goodbye, and keep healthy.